Colonoscopies. Nobody wants a colonoscopy, right? But it's also really important to make sure that you're getting the right colon cancer screenings so that you don't end up with colon cancer, which is significantly worse. When should you get a colonoscopy? That depends on who you ask and a number of details about yourself. In order for you to make the good decision, we're going to kind of go through those guidelines right now. So, I like the USPSTF, which is the Preventative Task Force that helps give some basic guidelines as to when colon cancer screening should happen. But when I was looking at their colon cancer screening guidelines recently, I realized that they actually disagree with the American Cancer Society. So I figured I would go ahead and take a look through some of this, and it turns like of the societies that get involved, the other one is the Society for Gastroenterologists. There's some disagreement. So we should probably talk about when are you actually supposed to start getting colon cancer screenings? What options are there besides colonoscopies? Because those can sometimes be a little uncomfortable. And what are the risks and the benefits of maybe doing some of those other options? So the big question to really start is, when should someone of average risk start looking at getting colon cancer screenings? One of the basic guidelines has always been at age 50, you would get a colonoscopy every 10 years. And that was easy to remember. Everyone loved it because it seemed to work. But as we've gathered more data and as more options have started to show up, there's maybe some wiggle room there, which is why the American Cancer Society has actually suggested that someone of average risk should start doing it at 45 instead of 50. We're going to talk through some of those things. One of the things that people are realizing is that up to 12% of colon cancers are actually diagnosed in people under the age of 50. So if 12% of colon cancers get diagnosed under the age of 50, we're not even starting screening until the age of 50. We're missing a lot of cancer progression there that it might be a reasonable idea to get started on earlier. So when you're trying to decide whether average risk should start at 50 or average risk should start at 45, one of the things you have to think about is, what is average risk, right? One of the things that you might want to consider there is just your racial identity. So African Americans are actually shown to have a significantly higher risk to colon cancer, a 20% chance higher likelihood of being diagnosed, and unfortunately a 40% higher chance of dying of colon cancer. So one of the things that you might think about, whether you're thinking you're going to follow the 50 or the 45 age guideline, is where do you line up in terms of that? It's an important thing. 12% of people under 50, 12% of colon cancers under 50, that is an important number and one that really shouldn't be ignored. If you are someone who happens to have a family history of colon cancer, the guideline actually changes significantly, and you throw that 45 and 50 out of the window, and you should start 10 years prior to the date of your family member and when they were diagnosed. And that's a big shift. So that's an important thing to think about. The other thing is, if you're having symptoms, you ignore all of that. You go talk to your physician and see if it's time to maybe start testing earlier. Symptoms include unexplained anemia, unexplained abdominal issues, narrowing of your stool. So if your poop is getting narrower, that's one of the things as well. Or if you're having rectal bleeding or signs of really dark stool, that could be a sign that there's something going on that you need to check out. The other thing to think about is, what kind of testing are you going to get done? To be clear, these guidelines aren't saying start a colonoscopy at this age. They're saying start colon cancer screening at that age. Colonoscopy, still by far the gold standard. And the reason for that is because a colonoscopy allows you to visualize the colon. You can see polyps potentially at a smaller age before they start kicking off chemically detectable signals that there's a cancer going on. And you're already there with the camera and the tool, so you can actually get biopsies, you can get samples, you can remove those polyps, all in the same setting that you determine they exist. Then you send them to pathology, you find out if they're cancerous. It's a very effective one-time thing. The other options, I tend to recommend only in folks who don't want to get the colonoscopy or aren't going to get the colonoscopy, are essentially a stool sample test. And there's a couple of them, and you could talk those over with your physician. Some you do more frequently than others and that sort of thing. Some are easier to get covered by your insurances than others. So sometimes, unfortunately for my patients, the insurance coverage situation determines which way we go. But those are not viewed as being as complete at finding a colon cancer. So those are imperfect options, right? So if you ask me, hey, Dr. Bland, which is better, a colonoscopy or a FIT test or a Cologuard test, I'm going to say the colonoscopy is better. If you say, well, Dr. Bland, I'm not going to do the colonoscopy. I don't care. I'm not interested in that. It seems uncomfortable. I'm not doing it. Well, then I say, now we're choosing between no colon cancer screening or we do a stool sample test. And I'm going to vote stool sample test over no screening all the time, right? So you need to have a talk with your physician about the things that matter to you, about your family's history, about your particular symptoms and health, and you need to make sure that you're talking about this. The important thing I'm trying to get out to you here is that talk probably should be starting closer to 45 to see if that's the age you should be doing this, as opposed to the standard number you may have heard floating around, waiting till 50. Both numbers could potentially work for you, but you need to have that talk about the risks and rewards of potentially starting earlier with your physician. Because as we talked earlier, even the physician associations don't all agree on this. And it's something that you need to have a talk to see where you fit, because you're not a statistic, you're an individual person, and your reality is not necessarily reflected in every other person in the country. This probably springs up a whole bunch of follow-up questions. Feel free to answer them below. I'm going to link a number of the different society guidelines that I've talked about, and you can take a look at those. But please, if you're in these age ranges, if you have any risk factors, have a discussion with your physician to make sure that you're screened and have the best chance at being as healthy as you could possibly be. Please be safe out there, y'all.